Today we'll be showing you guys how to do core exercise. Doing these type of exercise can help hold your adjustment in a lot longer.
We want to be sure that our patients and our friends know the proper way to do these exercises. Done properly, they can help the adjustments stay in place. We want you to get the strengthening without messing up your spinal line. So the first exercise we're going to do today is called the straight leg raiser. We have our lovely exercise model, Catherine, here today. She's going to show us all how to do this. So the first one is you take the right leg, you want to keep it locked out straight, and you raise it 40 degrees. So go ahead and do that. Raise it up 40 degrees, you hold it for 7 seconds, and let it down. Take the left leg, bring it up, hold it for 7 seconds, put it back down. Now, you do the same thing with both legs. Both legs at the same time, bring them up, hold it for 7 seconds, bring it back down. If you're having difficulty bringing both legs up at the same time, you can bend the knees and bring both of the legs up at the same time, bend them, extend them like this, and lower them slowly. Okay? You can straighten them out as you come down. It all depends on what your physical abilities are. So if you have some weakness in the core, or if you're having a lot of pain, the one where you're raising both legs up, that one's going to be the most difficult. So you want to kind of just do it within your physical ability.
Okay, speaking about weakness of the core, you can start off with this next exercise a little bit easier. So what I want is Catherine, bring both your knees up, okay, about shoulder width, and then the next thing you want is to contract your core muscles, and then push your back against the table. So Catherine, can you demonstrate that for us? So she's pushing her back against the table and contracting her core muscles. You want to do this you want to hold it about 7 seconds at a time, and you want to do about 7 times. Okay? And you can relax.
Okay. Since we're in this general position right now, we're going to do the bridging exercise. So you have your knees bent, and you're laying. You want to be on a floor is the best place to do these exercises. If you try to do them in a bed, there's too much push, there's too much give. You want to be on something that's firm and flat. A floor with a yoga mat or a relatively thick carpet or rug is usually the best thing to do. So basically with this bridging exercise, you want to be laying flat, you want to have your knees bent, and you want to have the feet about shoulder width apart. Okay? So the object is you want to bring the buttocks up off the table, not too much, just enough to carry the weight. While the buttocks is in the air, you take the right leg out and straighten it out 40 degrees, and you hold it for 1 second and bring it back down. Then you bring the left leg up. Okay? Hold it for 1 second, bring it back down, and you switch back and forth. 1001, 1002, 1003, 1004. And what you do is you step all the way to, you can relax now. And what you do is you step all the way to 20. Okay? You do those twice a day.
Okay, and the next exercise what we're going to do is it involves a little bit stretching, and a little bit exercise. So Catherine, what I want you to do is have both your legs straighten out. This is called knee to chest. So what you want to do is bring this knee up to your chest. Use both arms, grab it, and kind of push down. And then you want to hold this position for 7 seconds again. And once 7 seconds is up, you want to go ahead and let go of the arm and raise the leg straight up and then lower it slowly. Okay? And then you would do the same thing to the other side. You bring the knee to your chest, hold it with your arms, hold it for 7 seconds. And when 7 seconds is up, let go, raise the leg straight, and release it slowly. And then following this, you want to bring both knees up to your chest. And then again, hold it for 7 seconds. And once the second is up, again, you stick both legs up and slowly lower them.
So the important thing to remember when you're doing this exercise is when you're taking your right knee and you're pulling it up to your chest, you want to be sure you keep the opposite leg down as flat as you can. Okay. All right, what was the next one?
Sit-ups.
Sit-ups. Okay, so we'll do sit-ups now. Let me help you up there, Ms. Catherine. So basically what you want to do is you want to have your feet about shoulder width apart, So we'll do that now. And you want to have them up on the table or or just up on the floor, or however you want to do it. You want to be kind of level. You don't want to try to be doing these in a bed. You're just not going to get enough support. So while you're sitting, you hold your arms out, just like you're doing right now, and you lean back 45 degrees, and then you come back up. Lean back 45 degrees, you come back up. So the object is to do that 10 times. And as your physical ability increases, you work your way up to about 20. You want to do those twice a day. So, what was the next one, Doc? Did we get all those?
I think we got them all.
Okay.
Just remember that when you're doing these type of exercise, at any time you're feeling a lot of pain, you shouldn't be doing this exercise. It's okay, it's normal to feel a slight discomfort, but not excruciating pain.
You want to feel a little muscle soreness and things like that. You want to feel the muscles working. If there's anything really sharp or really painful, you probably shouldn't be doing these just yet until you're further along in the program and we've made more corrections in your spinal alignment. Okay?
Okay.
All right. Thank you for joining us today.
Thank you.